Hello everyone, my name is Audrey Cole and I work at the Western Connecticut Area Agency on Aging. I'm here with my colleague Amanda Halley and we're going to be talking about all things Medicare. I do want to mention the Western Connecticut Area Agency on Aging. Our main office is in Waterbury and we cover 41 towns in the northwest corner. We go from Salisbury to Barkhamsted down to Cheshire and down to Reading. So if you're in any of those huge towns, Northern Connecticut or Western Connecticut, please give our office a call. Now, the Area Agency on Aging, there are 5 in Connecticut. We handle everything based on your age of 60 or above, or if you're disabled. So if you are a family member or a caregiver, even if you aren't 65 or older and you aren't disabled, but a family member or caregiver, you can call our office and we can assist you on many different types of programs. So I'm going to throw this over to Amanda because she has some announcements before we get started on all things Medicare. Okay?
Well, thank you, Audrey. This is our second show with this cable group and we really enjoy spending the time sharing information with you all, especially around Medicare, which can be quite confusing. So I'm going to start, like Audrey. I work for the Western Connecticut Area Agency on Aging. The department that I work in deals with Medicare, Medicaid, and programs to help folks pay for those healthcare related costs. And we'll talk about some of those programs today. To begin, what I'd like to do is talk about a very exciting grant that our agency received earlier this year. It's a multi-year grant provided to us by the National Council on Aging. And it's called a Benefits Enrollment Center. And what it does is it works with Medicare eligible beneficiaries, those 65 and older, or those adults who have been deemed disabled and can be under the age of 65. Because the way it works is if you are disabled and you've been on disability for 24 months, after that time period is up, you are automatically enrolled into Medicare. So again, this grant and this program is designed for, again, those folks who are on Medicare and those folks who are on disability who have now become eligible for Medicare. And those folks who have limited income and resources available to them. So these programs and these benefits are designed to help pay for these healthcare costs. And the agency staff can screen folks for the programs that they may be eligible for under this grant. The programs include, and we'll go into more detail about these programs, Medicare Part D, the extra help program called Low Income Subsidy, the Medicare Savings Program, Full Medicaid, also known as Husky C for those who are on Medicare, and the SNAP program, the Supplemental Nutrition Assistance Program, also known as food stamps. So I encourage anybody who thinks they may be eligible for this program to please contact our agency at 203-757-5449 and press option 4 to speak to a Choices counselor.
I just want to add this grant is from the National Council
on Aging.
And this is a real feather in our cap for the agency because there's only one benefits center office in Connecticut and they chose our agency to do it. So we really have a wide range of assistance for people to help pay. If you're in a low income or rural area, there are wonderful programs to assist you once you go on Medicare because it's complex and confusing. So we're there to help you.
So Audrey, thank you very much for bringing that up because the grant covers the entire state of Connecticut. So although we as an agency only serve 41 towns in western and northwest Connecticut, we will be reaching out to folks statewide. So if you have a relative or a friend who lives not in the 41 towns that we serve, which you will be able to see when you go to our website, WCAAA.org. If you have a friend again or a relative in another part of the state that you think might benefit, please have them call our number to see if they are eligible. The other thing that I wanted to announce, and these are changes that folks, beneficiaries can expect going forward, and some of which these changes have already gone into effect, and it's the result of a bill that was passed last summer, and put into place by the current administration to start in 2026, phase 1 and phase 2 in 2027. And what it is a work community engagement requirement for those on Medicaid. And what that requirement is, or it asks for folks to have 80 hours per month of work, job training, any kind of volunteer work, and they need to have that meet that 80-hour threshold in order to be eligible to get Medicaid.
And I just want to interrupt for a second, because there's many different types of Medicaid in Connecticut. So depending on what age you are and what type of Medicaid you have, there's Husky A, B, C,
D.
and D.
Right.
And then, of course, there's a federal Medicare program, which is the Medicare Savings Program. So there is a work requirement going forward, but depending on what program you're in,
Exactly.
it differs.
And I think that it's important to communicate to folks related to this announcement that for those who are 65 and older, or on disability, or are now on Medicare, this work requirement may not apply to them. So I want to make sure that people know that, because we've gotten calls here at the agency asking if in fact this new requirement applies to them, and in fact it doesn't necessarily. But those who are on Medicaid D, for example, because Medicaid, D is for those 18 to 64.
Also known as Husky D, if you're single.
Correct. Some of the other changes that related to Medicaid review, in the past, it's the Connecticut Department of Social Services who are the folks who manage Medicaid in the state of Connecticut. In the past, there is what's called an annual redetermination, meaning your eligibility to continue to receive Medicaid takes place once a year. Starting in 2026, that review now will be every 6 months instead of once a year. What we foresee possibly, there may be some delays in getting paperwork through. Some of those Medicaid services might be delayed until all the appropriate Medicaid paperwork is submitted. So until people get used to this new regime, this new timetable, there could be some delays related to that. The other thing that we've seen relative to Medicare, keep in mind I've been talking about Medicaid, for folks who are on original or traditional Medicare, and Audrey will talk a little bit more about this going forward. If you're on original Medicare, you get what's called your Medicare summary notices every 3 months, all right? Going forward, you will only get them every 6 months. So again, that notification will be cut back to every 6 months instead of every 3 months. So these are some of the changes that are taking place, and I will end announcements by encouraging people that we have a wonderful volunteer program that both Audrey and I started in before we became employees of the agency. One for the Choices program, which I'm involved in, where we help people navigate Medicare and Medicaid. And Audrey will talk about her program with Senior Medicare Patrol. But if you're looking for an opportunity to give back to your community, get involved with a wonderful team at the agency, please give us a call. Contact us. There's wonderful support, wonderful training at both the local level at the agency and also at the state level. So that's basically all my announcements.
Well, I have one announcement. It is right now, we're preparing for the first week in June. We have what's called Medicare Fraud Prevention Week. Now, I am the program coordinator of Senior Medicare Patrol. And my specific program deals with and assists people once you are on Medicare and you have a problem. It's usually a billing dispute, or you see something in a bill or your Medicare summary notice or your explanation of benefits that's fishy. And people will call me because it could be fraud. Fraud is difficult to prove. You have to prove intent. So we keep an open mind. I'd say about 60% of my cases are billing disputes that I resolve in an amicable way, but about 30% is clear fraud. Like, people will see that Medicare was billed for catheters, and they don't have catheters. The doctor didn't order it. They will see $8,000 or $10,000 bills for diabetic supplies, and they are a diabetic.
It's unbelievable the amount that these folks get charged on their
Right.
bills.
And people, if you call the Medicare number down in Washington, one of the first questions they ask you is, what is your zip code? And then they will send you to the appropriate area agency on aging to help the fraud call. So my announcement is, right now we are booking events in the first week of June, because June is the month 6 and 5 is the day of the week. So the first week, 6/5/65, is known as Medicare Fraud Prevention Week.
That's cute.
Yeah, and so every year Medicare really wants people to promote the reduction and reporting of all types of fraud that can occur in Medicare. Anywhere from $60 to $100 billion a year is lost in Medicare fraud. That's only reported. There's probably much more. So you are the eyes and ears of what's happening on the ground, and we ask you to please call our office. You can ask for me directly if you see anything suspicious. And I'm just going to quickly promote a few things I have to assist this. So we do have this Medicare tracker. I'm going to hold it up. Ooh. And you can use a smartphone with this, and you can actually directly report a fraud. If you want to report it, you'd put your area code in there. And it will send you, your zip code, and it will send you probably to my agency and to me. But there are all kinds of games and information in this. It's a wonderful resource. People love it, but you have to have a smartphone, unfortunately. The other thing I have here, and people love this, I just got these. These are little refrigerator magnets. And these have very important numbers. It's got our 800 number to call. It's also got our local number down here in Waterbury to call if you don't want to use the 800 number. And then the Medicare number, the Social Security number. This is also the report fraud number to the Federal Trade Commission. The do not call registry number to get on the do not call list if you have whether it's a landline or a cell phone. Now, everybody says to me, I have a flyer about robocalls. Everybody says to me, oh, those don't work if you put your name on the do not call registry. All the honest people can't call you. So it will cut down on your robocalls. But I will tell you that criminals and fraudsters will continue to call you. So what you have to do is, if you're on it, there's also a number here to report it if somebody violates it and they continue to call. I just want to put a caveat, because if you have an existing business, they are allowed to call you. And this happens a lot during the open enrollment periods in Medicare. So what will happen is, I have a Part D drug plan, for example, standalone. And those people, insurance brokers, can call me and solicit me to sell me another plan.
Another plan.
So I do the second step that nobody does. If you get a call from a company that you do business with and you don't want to get robocalls from them, and many different agents who work for them, is you have to call them and say, take me off your solicitation list. So I have a flyer here about all the steps to cut down on robocalls. And I also tell people, if you want this and you want to talk to me about how to assist you in cutting down on all these robocalls, I'll send this flyer out. And then on the back, I also have all these important numbers. So these are just some of the goodies I have. But I want to remind you that the first week in June is Medicare Fraud Prevention Week. Be especially vigilant if you want us to have a table and you want us to have an event at your library, at your senior center. Give us a call, and both Amanda and I will come out and have a tabling event to promote everything related to Medicare. Not just my program, but also the enrollment in Medicare program, Navigating Medicare.
And programs to help you pay for your health care services.
So I want to ask, because I think it's really important that people know, especially last time when we were on, we get pretty standard calls that people are always trying to get us to answer. Medicare is very, very complicated, and you can't assume you know what it is, because you are a unique person and how you interact with Medicare will be different with everybody. So Amanda, I'm going to ask you a couple of questions that people call us up and how you would respond to them. What do you think?
Uh-oh.
We'll try that.
Let's see.
Okay. They'll call up and they say, well, I'm turning 65 next month. And they'll call up and say, what do I do? Do I have to report to Medicare? Do I call Medicare?
Audrey, this is, believe it or not, a call that we continue to get on a regular basis. And some people call us 6 months before they turn 65. Some people call us 6 days before they turn 65. So what we do is we encourage people to call as far in advance of them turning 65, so we can educate them as to what steps they can take. So,
and they don't call Medicare.
Well, exactly. If you are enrolled in taking Social Security, you will be automatically enrolled into Medicare.
So let's say you're 62 and you decide to take your Social Security benefit.
Correct. Then when you turn 65, Social Security will automatically enroll you into Medicare. And again, the way you enroll in Medicare is through Social Security. Now, some people are not taking their Social Security. They're waiting to their maximal eligibility age.
70.
70 is the last stop as to when you can take your Social Security.
There's no benefit to waiting after 70.
Correct. So for those folks who are not taking their Social Security benefit, they need to enroll in Medicare themselves. And you have a special 7-month enrollment period to enroll in Medicare. That's 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65. We encourage folks to enroll in Medicare 3 months before you turn 65, because that Medicare will start the first day of your birthday month.
And then, of course, there are people turning 65 who are going to continue working.
And we'll get to that. So let's say you're not working, but you want to enroll in Medicare. So you can enroll in Medicare by going directly to the Social Security website, ssa.gov. And on that website, it'll ask you if you want to enroll in benefits and in Medicare, and you can set up an account and you can enroll yourself. The other option is to contact your local Social Security office, and you can do that by calling them up, scheduling an appointment, which can either be done on the phone or in person, and they can help you enroll. And again, that Medicare start date is the first day of the month on Medicare. Now, the point that you brought up there are a lot of people still working. What that means is that they're still under their employer's health insurance. It could be just themselves or them with their spouse, okay? Now, when they turn 65, they don't necessarily have to sign up for Medicare, because if their health insurance through their employer is considered credible coverage, which is defined as being medical coverage equal to or better than Medicare, they do not have to sign up for Medicare at that point in time. They can continue to stay on their employees' coverage, but once they stop being on their employer's coverage, whether they decide to retire or they have to leave for whatever extenuating circumstance, okay, they have what's called a special enrollment period. And that is, if they're not signed up for Part B, they have 8 months to sign up for Part B once they lose that
This
insurance.
is why it gets complicated.
However,
People-
exactly. However, and that's a big however, you really only have 63 days. And the reason I say 63 days as opposed to having that whole 8-month period is you only have 63 days to sign up for a prescription drug plan. So whether you go the original Medicare or traditional Medicare route and sign up for a separate prescription drug plan, or you sign up for a Medicare Advantage plan that has a prescription drug plan, you have only 63 days. So what I do is I counsel people. Many people know that when they're going to retire, so we talk about timing. When should you contact Social Security, and how to make sure that your Medicare insurance goes into effect as soon as your employer's insurance stops.
I just want to emphasize this on the drug plan, because this is one of the most horrendous issues that we have to deal with occasionally. And it happens more often than it should. But a lot of people will turn 65, they'll do the right thing, they'll call up Social Security, and they'll sign up for Medicare Part A and B. They will not sign up for a drug plan because they don't have any medications. I'm really healthy. So they decide they don't. And then let's say they're 69 or 70 and they get their first prescription.
And guess what? And I'm so glad you brought this up, because let me back up for a second and say the reason we talk about 63 days, if you do not sign up, you will be subject to a penalty for life. And that penalty is a surcharge on the plan's monthly premium. And that surcharge is through a special calculation based on the number of months that you went without coverage, but each person is different in terms of how that calculation is put into place, but it's for life.
We had a case where some person had never signed up for a drug plan, and then she got a prescription in her 80s, and she found out that penalty was going to be about $75 a month.
And
so
that's a big chunk of change.
This is serious stuff. So if you have a question, call us on it, either 1-800-994-9422 or 203-757-5449. Ask for a SHIP or Choices counselor, or you can also ask for me. But this is really important. Don't try and guess this system in Medicare.
Well, there are so many little nuances. For example, if you are still employed and are thinking of signing up for Medicare and thinking of perhaps retiring, and you're contributing to what's called a health savings account, you need to stop contributing to your savings account, health savings account. Finally spitted it out.
That's okay.
6 months prior to enrolling in Medicare Part A. Okay? The reason being is that there's an automatic look back of 6 months. Basically, the upshot is if you don't stop contributing, you would be subject to a tax penalty. And a lot of people don't know that, because most people are premium free for Part A, which is your hospital coverage. Part A is your hospital coverage, premium free because you've paid into Medicare and Social Security for either 10 years or 40 quarters. It's Part B that you have a monthly premium for. Anyway, those are some of the little nuances, the 63 days, the HSAs, health savings account. Those are some of the things that people aren't necessarily aware of, and that's where we can help people and counsel them on them.
I just want to say, and then the other very important thing that people don't understand is there's original traditional Medicare, which was originally created in 1965. Then about 25, 30 years ago, Medicare Advantage plans were created. And people don't understand the difference between the two. So Medicare Advantage plans are private insurance companies that offer additional benefits that Medicare doesn't. So you really have to know the difference. And one of the most common calls we get is, my neighbor has a great policy, I want what they have.
And you know, we understand that, but everybody's different. With the Advantage plan, most of them have a drug plan that's available in Connecticut. People are on different drugs, different pricing. They go to see different doctors. These Advantage plans are based on network. And what that means is to benefit from these plans, your healthcare provider needs to be in that plan's network. Yes, there are plans that you can sign up for that permit you to go outside of network, but there are higher copays. I'm talking about those HMOs, those health maintenance organization plans, where to benefit most to stay in network. So again, you may not have the same needs as your neighbor or friend or your spouse. Again, everyone's health is different.
And I tell everybody, you don't know the health of your neighbor, and you don't know your neighbor's finances. So those are the two most important issues, is what your overall health is, what your medications are, to decide what a plan you will assist. Our agency, the Choices SHIP program, offers unbiased free counseling. We're funded through the federal government, so our taxpayer dollars really, we work for you for free, so please call us. And then the second thing is, aside not knowing, what everyone's individual health is, that's why we will bombard you with many questions. The second thing is what your finances are. And Amanda has a very important program that we're going to close on.
Well, what I wanted to tell people about, remember we said that we help people or screen them for programs to help them pay for their health care expenses. Well, here, as people have heard me say, this is the best kept secret in the state of Connecticut. It's called the Medicare Savings Program. It's a federal Medicaid program. And what it does is it helps people pay for their Part B premium, which everybody is subject to. It costs folks $202.90 a month. And if you are taking Social Security, it's taken out of your Social Security. If not, you pay Medicare monthly for it, or on 3-month installments. So it pays that Part B premium. It gives you extra help paying for your prescription drugs, where it caps generics at about $5 plus and change, and brand names a little over $12. But most people pay less for drugs.
And one of the most important points on this program is, in Connecticut, unlike many other states, it doesn't look at your assets.
Only income.
Only your income, and we have very generous income levels for the 3 different levels that you could possibly qualify for.
Right.
And they're very generous, much more generous than our neighboring states. So very important. So we didn't cover everything we wanted to cover today. We have a whole list of other items. So that means that we'll probably come back again. And if you would like us to answer specific questions that we haven't covered here, or even if you want to come in and join us and come in and that we can have a dialogue with specific questions you might have about Medicare, we discussed about doing a call-in show. So you can call the cable channel here and ask if you'd like us, if there were any questions that you'd like us to have on a future show, or you can call our office directly.